Hi, it's Doug from Rise Above Performance Training. In this video, I'm going to give tips for people that had a major injury that sidelined them from activity or athletics and either gone through surgery or physical therapy. They've gone through the series of physical therapy and now they're kind of in that no man's land where they can't just jump right back into their original training program. They still have to do some rehab work to get back to where they need to be. So what I'm going to do is kind of give some tips on how to transition back into your training program. First thing you got to do, you got to be accountable for yourself. Physical therapy is done, so you have to be the one that's going to be dedicated to doing your program and doing those remedial exercises to get you back where you are. The second thing is take those lessons that you learned in physical therapy and apply them. So if you like some of the mobility drills that they did, keep them in your program and use them as your warm-up or just within the program while you're resting for your other sets. The other two I like to do are high repetition work, and I usually use it with bands. So I'm going to show you some of the lower body ones that I do first with the bands, and then we'll go into the isometrics after that. So some of the lower body ones I like to do, let's say I have a knee injury and I had knee surgery, or even the hip. Terminal knee extensions, or TKEs. You're going to bring the band just above the knee, slight knee bend here, and then what you're going to do is you're going to contract your quad. So I'm going to squeeze my quad and straighten my leg and control it out. So for band work, I like high reps. I would probably do 15 to 20. And I just want to make sure my quad is doing the work. I'm not physically pulling my whole body back. I'm just squeezing here. Another one you can do are lateral steps or lateral walks. So I'm just going to get in a semi-athletic position. I'm going to step with one leg and then control with the other. Rebase, step, and control. And then I'm going to go back. This is the hard part. I'm going to step, control back in, step, and control back in. So that's going to build the stabilizer muscles of the hip and knee. Another one you can do is just simple hip extensions. So I'm going to take this foot off the ground, keep my posture, and I'm going to squeeze my glute and just extend the hip. So I'm just extending the hip here, controlling back, reset. I like to kind of let my glutes relax in between and extending through. So for those to be high rep, high reps do take a long time, obviously, within the training program. What I would suggest would be on your injured side, do 3 to 4 sets, and on your strong side, just do 1 set. So that way you save time and you're able to do other things during your workout. The other thing you can add in are isometrics. You've probably done some isometrics in physical therapy. Wall sits are classic, where they sit back and you can even lean against the wall and hold, builds up the quad strength. So you can do some type of wall sit. As you get better, you can start taking the wall away and hold there and build up your tension. But when that gets pretty easy, I like to do single leg things. So like a split squat or a split lunge is the way I like to go. So we're going to bring the foot up here. I'm going to flatten my foot. And I'm just going to drop down. This knee is not going to touch the ground, and I'm just going to hold. I'm going to try to build up some tension a little bit, so I'm physically contracting this muscle, keeping my breath kind of tight and steady, and I'm going to hold for about 10 to 15 seconds. I don't need much longer than that. Now, don't pop up out of this because this muscle's been on stretch. You can injure yourself again that way. So I'm just going to rest and then come right out of that. So those, like I said, I like to throw them in at the end of the workout and do them for minimum, 8 to 15 seconds. Don't go too long with those. Just build up that strength. And if you're still injured, you can also play around with the range of motion. Since these are range of motion specific, I can start here, work on the stability. If I get better within the weeks to come, I can drop down a little bit lower. So there you have it. Give those a shot. Bridge the gap between physical therapy and your training program, and it will get you back to where you need to be. Thanks.